A very warm welcome to all the members of audience to the webinar. It is the 11th webinar in series under Gapio Physiotherapy International Virtual Webinar Series. As many of us might be knowing by now, Gapio is a non-profit organization established in 2011. Padma Vibhushan Dr. Pratap C. Reddy, Chairman of Apollo Hospitals Group, is the founder-president of Gapio with a vision improving healthcare worldwide. With the aim to bring together healthcare professionals of Indian origin in the world on one platform. In these webinars, our endeavor is to bring the expanded scope and latest advances in the field of physiotherapy to the fraternity globally. Today's webinar is on visceral manipulation and the paradigm shift from disease care to whole person health. As healthcare continues to evolve, there is an increasing recognition that optimal health extends beyond treating isolated symptoms or diseases. The focus is shifting towards a whole person approach that considers the interconnectedness of the body's system, including the musculoskeletal, visceral, neurological, and emotional components. Visceral manipulation is a gentle, evidence-informed manual therapy that aims to restore the mobility and function of the internal organs and their surrounding tissues, potentially influencing pain, movement, and overall well-being. In today's session, we will explore how this approach aligns with the emerging philosophy of whole person health, broadening the role of physiotherapy from disease management to promote comprehensive, patient-centered care. It shifts the clinical focus from simply treating isolated symptoms or diseases to improving body's innate ability to self-correct, heal, and restore whole body structural harmony. I would like to make an announcement to put all your questions in the chat box, which will be taken up in the end. And I would now like to introduce our first speaker, Dr. G.K. Balaji, to speak as a subject matter expert for this webinar topic, visceral manipulation and the paradigm shift from disease care to whole person's health. To introduce Dr. Balaji, he is Director Synapse Physio Private Limited and Director Baral and Upledger Institute India and HOD Physiotherapy Department at Fortis Hospital, Mohali, India. Over to you, Dr. Balaji.
Thank you, Dr. Seema. I believe the slide is visible.
Yes, it is. You can make it slide share.
Very good evening, everyone. Myself, Balaji. I'm a physiotherapist from India. So I'm here to share my journey and experience towards the visceral manipulations and how I landed in learning that and how it's helpful to me in integrated when I integrate it along with my practice in a clinical practice. So this is the journey of me along with my physiotherapy related certifications which I did and which enhanced my skills to upgrade myself in the field of physiotherapy. Since being a physio, I've been practicing the last 25 years. So somewhere when I treat patients with chronic movement restrictions and chronic pain, somewhere I feel limitations where the symptoms do reappear again and again, and the patient come back with the same symptoms. When all my structural approaches, maneuvers get fails at one point of time. I was struck at that particular time. So that's the time I got introduced myself to the Baral and Aperture courses. I was very happy to meet the legend in the area of viscera manipulations, the father of visceral manipulation, J.P. Baral, who founded it, and my sweet mentor, D. Koning AJ, from who is the next speaker, from whom I inspired a lot, went in depth as much as possible to get learn each and every time. It's amazing to learn from him. And with his blessings, I decided to get more deep into the career of visceral manipulations. Then I was able to do a couple of good certification education in visceral manipulation and related therapies from the Baral and Aperture, which made my knowledge more strong, better, stronger to treat patients. So once as a physio, as I mentioned that I was getting encircled in a structural area, treating more of a bone, muscle, and a nerve with what all approaches I've been taught in my schools. So one particular time when I'm struck up with the patients reappear with the symptoms, then I understood the movement system and the pain factors is never unifactorial, and it's the assessment, the evaluation comes from multifactorial reasons. So it could be a multifactorial component uh, contributing to your restrictions in the movements and pain. So one a therapist should be aware of these multifactorial element or the other systems of the body impacting the musculoskeletal system. If I'm a therapist working in the MSK system, I should be aware of the other systems also, which impacts or influences my MSK, where my symptoms are just like a television display, which is shown in the musculoskeletal system, where the main supply or the power comes from somewhere else. So that's what I got inspired when my tutor AJ teaching visceral manipulation to us. So that fine day made myself change as a different therapist, and my practice changed, and my knowledge, in fact, spreaded more depth into it. This the common picture which shows in a textbook where every systems of the bodies are integrated or interconnected. Each and every part in the body is interconnected via neurologically, neurons, interneurons, and as well as with the facial connections. So once I did had a doubt how will the organs move? Does the organs really have a movement inside the body? But we don't see it. Like how do we move our limbs, upper limb and lower limb? We don't see it. So then so this small video of ultrasonograph video helps me to understand each and every breathing maneuver, the breathe. Your organs has got an impact of movement. Uh, it's not only moving superior and inferior, it is also internally moving in a three-dimensional directions, where if there is a, as per JP Baral, if the organs do not move and it gets into restrictions, your health will be impacted. So that's how the concept of visceral manipulation started. So I'll just highlight, we have the great instructor AJ next to me going to give a deliver in a depth of visceral manipulation and introduction to you all. So I will just speak with related to specific to my practice, what inspired me and how it changed. So when I deal with patients of low back pain, and when I went to the visceral manipulation, when I found that the organs have a deep connections with the spine. So you can see this in the small cadaveric video where you have the small intestine. You can see how the strong facial connections of the small intestine is so strong attached to your lumbar spine in such a way, even if you hold the intestine, you'll be able to rock the whole cadaver. So, so this is such a strong attachment. So then we understood it made me to understand much more better. So when we have a MRI or a scan X-ray picture coming from the back showing one vertebrae slipping over the other vertebrae or a disc bulging out, so it not necessarily always it's a true structural problem. Sometimes the viscera the intestine, the organ connection, the tight fascia can have a tension or a pull in the spine, which could cause a dearrangement in the disc or the vertebrae, which could be picked up from an MRI, and we keep treating the MRI without getting into the underlying cause. So this was an eye opener for me in treatment of low back pain. Then when I treat with patients with females with lower coccyx pain, but when they have dysfunctions in the uterosacral ligaments, then I've treated good number of patients of cervical who have a facial restrictions from the lung ligaments and as well as the heart ligaments, which both the ligaments are connected to the cervical vertebrae. When somebody's have a restrictions in these fascia, you will have a tension in the cervical vertebrae, and which will cause you can cause you neck pain as well as a cervicogenic headache. So with this inspiration, when I started treating patients with this knowledge, and I thought that I should do some case studies to document what I do. And we were with a university. We tried taking some patients with a non-specific neck pain, and we did a posture screen mobile application to measure their posture, forward neck posture, protruded posture forward, and neck disability index, and a VAS scale to measure their pain, and a simple pressure biofeedback unit to measure their muscle power. So what we found out is one single session made a good impact in improving the forward neck posture before and after visceral manipulations, and the range of motion did improve. And the one fine thing which we were able to find out, the muscle power did not had any change, which indirectly says that visceral manipulations can impact the movement restrictions and pain, but the muscle power, the tone of the muscle, yes, could be impacted from visceral manipulation. But for the power to improve, one needs to do an exercise followed with the visceral manipulation after the 2 to 3 weeks gap of post session. Then also another case study we tried to document it with shoulder adhesive capsulitis. I have seen more than 50 to 60 patients with adhesive capsulitis after getting into visceral manipulations. It's an amazing thing to release the liver and release the shoulder capsule before you enter into a rehab program with the phrenic nerve connections. Here again, we found the range of motion and the pain drastically improved with visceral manipulation of liver. So I even wanted to test it under what if there is a neurological condition that's coming from the central nervous system, from the brain, stroke, whether this will be the same. Here, we did face some challenges with the same techniques and maneuver because there are other musculoskeletal components which are restricting the shoulder ranges to improve, like your spasticity coming into picture. Even after the visceral manipulation, I couldn't get into good ranges because of the musculoskeletal system over impacting on with the pectoralis spasticity and the other muscle spasticity, pulling the shoulder into more limited range of motions. So this was a small video which we were trying to take during a small camp in Chandigarh. This lady had shoulder stiffness for very long years, and she came for the camp. You can see the facial expression of the patient while lifting. She's not comfortable. Beyond this, if she's going to stretch, she will experience a big pain. So single session of liver release. It tried, and immediately we measured it. You can watch carefully the ranges as well as the face of the patient. The range is immediate. There's a smile in the patient's face immediately post the visceral manipulation, and the smile is coming because of the pain is immediately reduced. Post, you can see the range is going full, and she's so happy to this thing. So this is the magic in the visceral manipulation which happened, which helped my rehabilitation program. So we do have I'm also the director of Balaji Institute India. AJ is our ambassador who comes and teaches Indian students visceral manipulations very frequently to India. Many visceral therapists have developed through him. like me. So we have the Visceral Manipulation Level 1 course coming in Mumbai this December 11 to 14. You can access us from the Instagram page of Beral Institute India, Beral and Applied Institute India. You will get the details. So post the session, if people are interested, could contact us. So understanding the concepts of visceral anatomy, techniques, and clinical application of visceral manipulation will help therapists to do a multifactorial assessment and delivering a comprehensive integrated therapy for pain and movement description. I have spoken only in specific to related to my field of physiotherapy, but visceral manipulation is very vast and wide. We have many evidences starting from musculoskeletal system to physiological system and the latest research with even the immune responses, the immunity changes, immune responses changes through vagal nerve application has also been published. So it's very vast and wide. I'm like you, I'm also eagerly waiting for AJ to deliver a talk and to get mesmerized from his speech. Thank you, Dr. Seema, for providing me this opportunity to be on this platform to share my experiences. Thank you very much.
Thank you, Dr. Balaji. As ever, it's a pleasure talking to you, listening to you. So you have set the ball rolling, I believe, for our keynote speaker, AJ, as we call him. So you definitely told that how your journey and through you, how many people are now changing, physiotherapists are changing their practice. So without any delay, now I would like to invite our next speaker, whom we call in his short name as AJ. So AJ is an international teacher, professor of craniosacral therapy and visceral manipulation, director, CEO, ICOMM, which is International College of Osteopathic Manual Medicine. He is taking his talk from Italy. He's an osteopath, private practice, and Brecciano and Formello, Italy. He has published various researches on visceral manipulation studies. He has been coordinator of clinical research projects on the efficacy of visceral manipulation in the cardiac field and various presentations in international conferences and seminars on manual medicine and osteopathy. And he took my request and he's here. He has started his day an hour early just to accommodate us. Thank you so very much, AJ. Over to you now to share your views on visceral manipulation, the paradigm shift from disease care to whole person's health.
Okay, thank you very much, Dr. Grover. First of all, before I start my my presentation, I'd like to thank Dr. Seema Grover and Dr. Balaji for the collaboration and making this possible. So I will try to get my message across of the importance of visceral manipulation in healthcare. So what I will do, I will go through a series of slides with you, which this is not intended to be a lecture. This is intended to get a message across of the importance of the organs, of the visceral mobilization in healthcare and how it's related to the musculoskeletal system. So let me first share with you a question. A question. Okay, can you see my slide now?
It's visible.
Okay, thank you. And here we have, good. So again, the title for today was Visceral Manipulation and the Paradigm Shift from the Disease Care to a Whole Person Healthcare. Now, it's not possible to talk about visceral manipulation without explaining a little bit the history of visceral manipulation and the origins. And the origins is coming from osteopathy. The founder of osteopathy, Andrew Taylor Still, who is also the founder of the first university of osteopathy in Kirksville in America. And he was the founder of osteopathy, being a surgeon and also an engineer. So he was this. He had a very good basic intellectual development, and he developed also a special vision on health and healthcare in our human body. So let's explain a little bit about the concepts and the philosophy of osteopathy, because I don't know the participants how much they are aware what is osteopathy and where it comes from. So osteopathy was founded in 1874, and like I said, the first osteopathic university was opened in Kirksville, Missouri. I like to underline this because this is not like a healthcare profession which is in the sidelines, but it's an official education in the healthcare system in America and also in Europe. There are now more than 27 osteopathic universities in the United States. And also we have now in Italy about 5 universities who have started their curriculum in osteopathy. So the osteopathic philosophy, in very short, is that osteopathy sees the body as a unit, and that the person is an integrated combination of body, mind, and spirit. So no part of the body functions independently, and a lesion in one part of the body can ultimately affect the whole body. Because in the development of the human body, everything obviously starts from the zygote and the blastocyte. Everything comes from one cell and then develops from that. So anybody who has some embryological background understands that all the systems in the body are interconnected. And therefore also the philosophy in osteopathy, we see structure and function are interrelated. So anatomy and physiology are mutually dependent. This means that when we have anatomical lesions, when we have restrictions within in our tissue, then physiology will be affected by it. And then again, also the philosophy of osteopathy shows that the body possesses a self-regulatory mechanism or homeostasis. Andrew Taylor Still was convinced that a lot of problems which start in the body, that the body can handle it by themselves. And that's what he started to develop this approach in healthcare, to work and resolve the bodily lesions and the tissue lesions to help the body function better and to regain health without outside intervention of medicine and operations. So it's a manual medicine. That's very important to understand. Now, there are 3 parts we can see in osteopathy. So we talk about cranial osteopathy, and we're talking about the central nervous system. So the lesions which can develop within this system, which also obviously affect the neurological connections within our body. And we have specific techniques to deal with lesions within this part of the body. Then we have the visceral osteopathy. So we're talking mostly about the visceral mobilization, manipulation in this seminar here. And then we have the osteoarticular osteopathy. And osteopathy is very important to find the cause of the clinical symptoms. Because what Andrew Taylor Still said, everybody can find pathology, but it's much more difficult often to find the cause what causes the pathology. So that's why our diagnosis in osteopathy is to find the cause of the disease. It's done through a whole body evaluation, in which we go from the feet to the head. We evaluate the whole body and we try to understand which part of the body does not function well. So we cannot talk about visceral manipulation without mentioning Jean-Pierre Barral, who for more than 30 years has been my mentor, my professor, and I've learned an incredible amount of information from him, and I'm grateful for life what I've learned and experienced with him. He has written more than 20 books in the osteopathic field, and mostly, of course, about the visceral osteopathy, because he has done a lot of research in visceral osteopathy. So let's see the osteopathic approach within visceral manipulation. Now, the first step is very important to understand that each organ has a neurological connection with the central nervous system. And we have afferent nerves going from the organ to the central nervous system. And these segments, when we have a dysfunction within the organ, this can create dysfunction in the neurological related segments. And this is very important, the first step, very important to understand, because this means when we have a dysfunctional organ, it will create symptoms within our musculoskeletal system. And I will show you other slides to make this understand better. So another example is, for example, the liver. Also, the liver is segmentally related to the central nervous system, but then also it has innervation by the phrenic nerve, which is connected to the C3, C4, Sec5 segments. And this means that we can have a dysfunction of the liver, and this can create pain and dysfunction in the shoulder. Now, this is what I learned also in my background as a physical therapist, because I started as a physical therapist, but then for one reason or another, the symptoms were not resolving, and I started to look for answers why my treatments were not resulting in a good function of the articulations which I was treating. And then very slowly I started to understand there was a different cause of these symptoms. So for example, when we have an hepatitis, then many years later, this hepatitis creates a mobility restriction. It creates irritation of the receptors in the fascia around the liver. And then this relationship, this facilitation of the central nervous system and the phrenic nerve can create symptoms far away from where it comes from, of the cause of the problem. So if you want to resolve a shoulder problem, okay, many cases you have to treat the related organ. And that is the big difference between, let's say, the physical therapy approach and the osteopathic approach. So, for example, here you can see, of course, this is a computerized model, but that when we have infections, when we have inflammation, when we have trauma, then this inflammation can create adhesions between the wall of the abdomen and also between the organs. And this has a big effect on the physiology because the vascularization diminishes, and also we have an irritation of the receptors which are innervating the organs, and then they will have an effect on the central and autonomic nervous system. So here again, what you can see is the relationship between an organ it has a facilitated segments. So the segments related, innervated, which come from the stomach. So what they call afferent nerves, and these create then facilitated segments in this central nervous system. And then what you also see here, this is the phrenic nerve. So also the phrenic nerve has motor nerves, of course, which are responsible for the innervation of the diaphragm. But within the phrenic nerve, there are also afferent nerves, and the afferent nerves go from the organ to the spinal cord, and it creates a facilitated segment on C3, C4, and C5. And then again, on the left side. So it means that we can have shoulder restrictions caused by problems within the stomach, for example, when we have a gastritis. Now, here is also, like I said, a very simple slide explaining the relationship of the visceral system and the musculoskeletal system. So what's happening when we have a problem within the organ system, because and these problems can be caused, the lesions can be caused by, again, like I said, infection, trauma, but also very often by psycho-emotional stress, because the psycho-emotional stress in our body is discharged through our visceral system. So this creates a dysfunction in the visceral system, and then this creates an irritation and facilitation of the afferent nerve, and this creates what we call the facilitated segment. What you can see here is that the organ will create a spasm in the musculature. So it means that whatever work, therapeutic work you do on the muscle will not respond, because the muscle depends on the innervation from the facilitated segment. And if you don't take care, if you don't mobilize, remobilize the organ, this muscle spasm will never resolve. Also, of course, for example, what the chiropractors do, the vertebral mobilization, when we have a facilitated segment, we can have a vertebral lesion. And also you can mobilize this lesion here, but the problem will come back because, again, the cause is within the visceral system. So that's to underline the importance of visceral mobilization in healthcare. Many people are suffering also chronically, and whatever they try to do on the symptomatic area, it does not respond, it does not work. And you can give medicine, you can do therapy in this area, but it will not respond unless you deal with the visceral problems. Now, here is Irving Kaur. He has done many years of research, and he has shown scientifically the existence of the facilitated segment. And he explained the visceral pathophysiology, which then creates a dysfunction in the musculoskeletal system. What I just showed you in my slide, to explain it in a very simple way. But it's also very nice maybe to mention here that Irving Kaur was also an enthusiastic musician, and he was playing in a small orchestra together with Einstein. So he was in a very good company for that way. So here I'd like to start to talk about the autonomic nervous system. And of course, apart from the segmental innervation between an organ and the central nervous system, we also have an innervation of the autonomic nervous system. And each organ has an autonomic nervous system innervation. And also the vagal nerve, what you see here, the vagal nerve, each organ from the thyroid until the rectum is innervated by the vagus nerve. So each organ has an innervation of the vagal nerve. And this is also very important to understand how the visceral system can create problems within the body. And here also, for example, which I will shortly mention, is that our posture, okay, is very dependent on our visceral system, because when we have a restriction within a visceral articulation, we have a restriction within an organ, the information, the receptors of that organ inform the brain that there is abnormal pressure, there's pathological pressure or pathological tension on that organ. And then the brain immediately will intervene and change the posture to diminish the pressure, the pathological pressure and tension around that organ. Because we are designed in such a way that we always want to survive. So it's very important that our vital organs are not, let's say, damaged. So that's what we can see in every patient and every day in our work, is that the posture is changing because of visceral lesions, restrictions, and immobility. So if you want to improve posture, very often what you need to do is improve visceral mobility, and this will improve your posture. And if your posture improves, then also the musculoskeletal system suffers less dysfunction. Now, the next thing I wanted to add is also what we have in our body is the visceral loop. This means that an organ and a dysfunction in an organ, like I said, we have the afferent, which is related to a segment, but then the nerves, the efferent nerves, which go to a related organ, a segmentally related organ. This organ also can start to cause dysfunction. And I wanted to explain this in an important way, because we have done many years of research, which I now want to share with you. And we have found that the gastric dysfunction has a very important influence on our heart muscle. So the visceral loop in atrial fibrillation. Now this started when I was working with patients and was working on restrictions within the stomach and the gastric area. And then apart from the patients telling me that the function was improving, that also that their symptoms with arrhythmia had diminished. And that time for me was not known, and I was surprised by that. So I was really eager to research this connection within the body. Then one of my patients, I was lucky that he came in, was Dr. Stefano Bianchi. He came in as a patient, and I treated him, and then we started to talk about my experiences with arrhythmia. And he invited me into the hospital to start researching this relationship between visceral organs and the arrhythmia. So what you see here is Dr. Stefano Bianchi in the hospital, in the operating room, where he deals with arrhythmia in a medical way. So we started a research together in 2014, and this lasted until 2026, till let's say this year, and we're still continuing because we're finding things that are really not known, not in the osteopathic world and not in the cardiology world. And we have found really encouraging information, and we have very encouraging results and which explain this visceral loop. So we have the relationship with the gastric area, which has an effect on the heart muscle. So let me go a little bit more in detail here. Every organ in our body has a very highly innervated part by the vagus nerve. And there are many, many receptors with the vagus nerve. So we have mechanoreceptors, chemoreceptors, baroreceptors, immune and cytokine receptors, all related to the vagal nerve. It means when we have a dysfunction in our stomach, then we have a facilitation of the vagus nerve. And of course, we know also that the heart has a very important innervation by the vagal nerve. So there is a strong neurological relation between the stomach and the heart muscle. So why specifically the stomach? Because what I will show you is that the presence of the vagal nerve receptors is very, very, very high in the stomach area and much less in the other organs. So what you see here in a computerized model is that the vagal nerve goes into the wall of the stomach and then has many millions of receptors, which in a case of gastritis can create a vagal tone increase, and this goes through the central nervous system and then starts to influence the afferent vagal nerves to the heart muscle. So what we see here is that various research has indicated that gastrointestinal afferents have and the gastric distension has an effect on the heart muscle. So we have many indications that the dysfunction in a stomach creates dysfunction in the heart and creates arrhythmia. Here is another research. What they did is that they created the gastric distension, and this created an arrhythmia within the heart muscle. And that's basically what we're doing, is we're mobilizing in osteopathy the gastric area, and that way we diminish the receptors irritation and diminish the vagal tone. So very often by increasing the gastric mobility, we decrease the arrhythmia and atrial fibrillation. So what you see here is the highly innervation, the intrinsic innervation of the cardiac wall by the vagal nerve. So we're still going on with our research, and we hope to get more details out shortly. So what we see here again, the neurovisceral fascial osteopathic mobilization diminishes the vagal nerve facilitation, and that has a very important effect on the atrial fibrillation. So this is what I wanted to share with you, and I hope it will opens up some important information for you to work with your patients.
Thank you so very much, AJ, for such a highly informative presentation. I believe, as you rightly said, that it will open up, or it is a food for thought for people, that when physiotherapists are not finding results, then what they should look for. So I appreciate the depth of knowledge you shared and the practical perspective you brought to us today. Thank you for your time. And without taking any further time, I believe I'll introduce our own Dr. M. Raj Prasanna for his vote of thanks. Dr. Raj Prasanna is Head and Chief Chennai Division, Physiotherapy and Rehabilitation, Apollo Hospitals, Chennai. He's principal to Apollo College of Physiotherapy, Apollo Institute of Medical Sciences and Research, the Apollo University, Chittoor, having 25 years of professional and clinical experience, along with the academic and research activities in the field of physiotherapy and rehab. His area of specialization is neuro rehab. I definitely feel it is more of pediatric rehab. So over to you, Dr. Raj, for thanking our speakers who have really shared the insights into a newer field where we can improve our skills and maybe get answers to few things which sometimes we do not achieve. Over to you, Dr. Raj.
Thank you, Dr. Seema, for your wonderful introduction. And I thank the speakers for the wonderful session. Before that, I would like to thank the Gapio Physiotherapy International Lecture Series, which has been organized by the Global Association of Physicians of Indian origin. And Dr. Seema for taking this way forward. You have been doing a great job, Dr. Seema. And with regard to today's session, I thank our esteemed speaker, Dr. G.K. Balaji, Head of the Department of Physiotherapy from Fortis Hospital, Mohali. Sir, your topic on integrating visceral manipulation in the management of pain and movement restrictions was really wonderful and very interesting, sir. You have detailed about the assessments of movement systems and pain factors, and your explanation on the movements of internal organs, which you have displayed through the musculoskeletal ultrasound, was awesome. And I'm sure we will be having a lot of participants will be interested to participate in the visceral manipulation course, which is to be held in Mumbai this 11th to 14th of December. Thank you for your wonderful introduction session, sir. Thank you once again. Coming to our keynote speaker, Dr. AJ, Dr. Adrianus Jacobus, thank you, sir, for your valuable time for our gap year session. Your topic on visceral manipulation and the paradigm shift from disease care to whole person health was an eye-opening session, and you have shared the importance of visceral manipulation in healthcare and its relationship with the musculoskeletal system was very helpful, sir. Your introduction and description of osteopathy practiced worldwide was awesome. You have explained on cranial osteopathy, visceral osteopathy, and osteoarticular osteopathy was very informative, sir. Thank you so much. Finally, and you have given as an eye-opening that improving visceral mobility improves the posture was really very helpful for every physiotherapist. Thanks for the wonderful learning opportunity, sir. I once again thank Dr. Seema for organizing such a wonderful event and moderating this session. Thank you once again. Thank you.
Thank you, Dr. Raj. And before we come to the close of session, we have certain questions in the chat box. I would like both the speakers, they can help us in answering. Question 1 is, how do you clinically assess which patients would benefit most from visceral manipulation? So over to you, AJ or Dr. Balaji.
Okay, so well, we have a whole body evaluation protocol with listening techniques. So there are palpation techniques which bring you to an area of the body where mobility has diminished in an important way. So we have special techniques, manual techniques, to find the areas of dysfunction.
Thank you so much. It definitely, the listening techniques really work to really find out, and they can be checked, I believe, even on ultrasound that you find variations. So the next question comes, how important is collaboration with other specialities when practicing visceral manipulation?
No, if I can may, we work with the with many.
Your voice, you are muted, AJ, by mistake.
Sorry. Oh, here I'm again.
Yeah.
So we work with many specialists in the hospital. So depending on the problems of the patient itself, we work with a neurologist or an endocrinologist or a specialist in the digestive system. So I think it's very important for the patient, because very often also a medical specialist has not all the possibilities to help a patient. So working together for the patients always offers the best solutions.
Yes, I believe definitely, like in your research projects also, it's been shown that you are working on visceral, so definitely cardiologist is involved. Another question is, can you walk us through your clinical reasoning when a patient presents with chronic unexplained pain?
Again, very important here is to understand, evaluate the body, see where the dysfunction is, and then see if you can explain the pain, if that's related to that specific dysfunction. So very often, for example, we have many patients who have chronic migraines or chronic headaches, and by evaluating and finding the organs which are in dysfunction and create these migraines and headaches, then very often we're able to resolve and help the patients and have a better quality of life.
Thank you so much. One from my end, I believe to our listeners, can we talk to them about what are the contraindications where we should be, not exactly contraindications, but we should be cautious before we look for visceral manipulation?
No, of course, when there are specific indications, also within the autonomic nervous system. So when there are symptoms, and especially like night pain and symptoms which we cannot explain, then very often it's important that we do more research on their problems. So we need more information and diagnostics apart from of our own. So it's always a collaboration again with other specialists in case there is doubt about the seriousness of the disease.
Thank you so much, and thank you everyone for taking out time for our today's webinar. I believe it should be like what we always put in our virtual webinar series, that is the extended scope of physiotherapy, what physiotherapists can think beyond physiotherapy and find out answers. So I would like to take a moment to thank all of you, all the esteemed speaker, Dr. Raj, for being here, taking your precious time out to be a part of our webinar, to share your rich experience and knowledge on visceral manipulation and the paradigm shift from disease care to whole person's health. I believe the world is going towards whole person's health now. We all don't only treat symptoms, but we really look at how a person can live healthy. So at the same time, I would like to express my gratitude towards current leadership of GAPIO and Professor Dr. Anupam Sibal, the Group Medical Director of Apollo Hospitals, for his constant support. It was his dream that physiotherapy should also be included as a part of medical field where everybody comes together and we get a wholesome healthcare. So I would like to thank him for his constant support and vision for enabling such a platform where it helps us breaking the glass ceiling and provide superlative healthcare services, what Apollo in India is known for. So I would like, in the end, I would like to thank all the member of audience for being a part of this webinar, making it a lively and interactive one. And thank you once again, Dr. Balaji, Dr. Raj Prasanna, and of course, what I learned from you, AJ. Thanks a million for that, because that gives you a different feel. So thank you so much for finding out time, for sparing your time, for being with us. And I hope you all have a great evening. It's a weekend, and I believe I've kept many people on this weekend with us, irrespective that they might be having their own time. So thank you, and I look forward to see you all again in the next part of our webinar series. Thanks a ton. Thank you for your time, for your information, for your knowledge, and any words of wisdom from you, AJ, once again, because it's hard to find you.
Okay. Thank you very much, Dr. Seema Grover, and hope to see you all again in India. Okay.
Yes.
Bye-bye. Thank you. Thank you.
Thanks, Dr. Balaji. Thanks, Dr.
Thank you,
Raj,
Dr. Seema. Thank you,
for
AJ.
being
Thank you,
here.
Dr. Raj.
Thank you, Balaji.
Yes. Bye. Bye for today. Thank you, Dr. Raj. Thank you, audience, for being part of this webinar.